We're with Dr. John W. Tyrone, aesthetic plastic surgeon. When we're thinking about having a procedure done, it's important to know something about the doctor that might be working with us. Tell us about yourself.
I'm a board-certified plastic surgeon. I've been in practice for about 10 years now. I think one of the most important things for patients to understand is that they do need to look for a board-certified plastic surgeon because there are some physicians that do cosmetic procedures that aren't trained in that type of specialty. So that's one thing that board certification assures you is that the surgeon has had training in that specialty. For the last year, we've been in the North Florida Plastic Surgery Center. It's a business that we started at that time, and it gives us the opportunity to kind of expand the practice and offer more services to patients.
I don't have to worry about finding a hospital and paying hospital fees for my room and my stay there. It's all done here, is that right?
Yeah, that's correct. We have a fully accredited surgical suite where we're able to do surgery, so patients only have to come to one location for their pre-op visits, for their surgery, and for their follow-up. It makes it a lot more private for patients doing this type of surgery. They don't like to go to the hospital often.
What type of services or procedures do you offer?
We try to offer the full line of services for cosmetic procedures, anywhere from skin care, laser resurfacing, then all the surgical procedures as well, ranging from facial cosmetic surgery, breast, tummy, liposuction. Those are probably our main services.
And what are some of the typical questions you hear from people who are maybe thinking about procedures and maybe they're a little apprehensive?
It just depends on the procedure. I think a lot of patients need a little help deciding what will work for what they're trying to achieve. So, for me, I usually ask patients what their goal is and then try and figure out a surgical plan that meets that goal rather than trying to just offer them what they come in thinking they're going to need, because it's often not correct. Even simple as a breast augmentation, a lot of patients come in that think they want to be double D-cup breasts, and that's generally not a good choice with implants. So we try to educate patients.
Okay, Sheldon, now I've made my first appointment for my first consultation with Dr. Tyrone. Take me through the steps.
Well, you'll come in and you'll meet with Dr. Tyrone, and I think the very first question he'll ask you is, what's your goal? What do you want to achieve? What bothers you the most? Do a quick exam. And help you develop a plan to achieve the goal that you're looking for. Then you'll sit down with our patient care coordinator. She'll go through the financial aspect. She can schedule you for surgery, your pre-op appointment. You can look at books with her, our before and after photos.
It's so thorough and it's so comprehensive, but also so caring. And that leads me to my next question, which is patient care is very important to you.
It's utmost. Yeah. Patients wouldn't come visit us if we weren't kind to them and didn't care about them. And
I see patients leaving and coming in and being greeted as friends, and it's wonderful.
It is, and it is a sad day when we do have to discharge them because we do miss seeing their faces.
So, doctor, you can help me with this, right?
We could probably help you with that a little bit. Come talk to me.
And many more issues as well. So you want to call Dr. John W. Tyrone, Aesthetic Plastic Surgery Excellence in Cosmetic Surgery.